Hello, my name is Dr. Harpinder Shivchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some questions about dental bonding. One of the very first questions that comes up is what is dental bonding? So, dental bonding is actually a term that we typically normally use as a term for what we call composite restorations. Bonding means bonding something to a tooth structure. So composite restoration, which are resin restorations, they use the background of it is bonding materials. So since we bond them to the tooth structure, thus where the terminology come as a dental bonding. That's what most of the patients refer to, dental bonding or composite or tooth color restoration. So they typically are very much the same, one or the same thing. Another question that I do come across I get asked is when is dental bonding recommended? So there could be few scenarios where dental bonding could be recommended. One of the very common scenarios, if somebody has worn out teeth or there's even some staining on the teeth or there is some chipping, some of the chipping on the teeth can be solved by dental bonding. If there's some staining on the teeth, we could solve that by dental bonding. It depends on what kind of stain there is on the tooth. And also to enhance the shape of the tooth, we can use dental bonding. To enhance the size of the tooth, we can use dental bonding. And actually, if there's a cavity on a surface which is front facing of the tooth, we can use dental bonding to remove that cavity and put dental bonding in that place to restore that tooth structure. So those are some of the scenarios where recommendation come across for dental bonding. Another question I do get asked is what are the advantages of dental bonding? Dental bonding, actually, one of the biggest advantages that it can be a very minimally invasive procedure. Most of the times, especially in cases where we are using it for enhancement of the tooth structure, meaning that we are enhancing the shape of the tooth. If somebody's tooth is misshaped, where we are actually adding the bonding material instead of cutting a tooth structure or doing anything else to the tooth. So in that case, it's a very minimally invasive process where we can enhance the shape of the tooth. We can enhance the size of the tooth. So very minimally invasive process is most of the times actually additive process to the tooth. Another question I do get asked is, do bonded teeth look natural? Yes, bonded teeth can look very, very natural because most of the times when we are doing dental bonding, a lot of times it is to enhance the shape of the tooth, aesthetics of the tooth, beauty of the tooth. So we are using tooth color, matching the color of the bonding to your tooth structure. So when it's done, finished process, finished product, your tooth looks very, very natural. Another question I do get asked is what is better, dental bonding or veneers? To answer that question, it depends what is the treatment recommendation. Why are we recommending bonding versus veneer? So dental bonding could be advantageous and better treatment in one case scenario versus the other. So for example, let's take this scenario. If the tooth structure is really worn or we are looking for in an area where we need more function, we need more strength, that area will be more suited for a dental veneer because they are more stronger restoration, they last longer. In the other case where we are not looking for so much of a strength and is smaller area, that will be better treatment would be dental bonding. So the best thing would be to go to your dentist, get evaluation done, and your dentist will give you the treatment option depending on what your case scenario is, why you're needing one versus the other, and what is advantageous in your case. So talk to your dentist, go for a consultation, let them evaluate, and then they will go over with you what are the pros and cons of one versus the other, and again, what is better in your case scenario. Another question that I do get asked is dental bonding painful? Dental bonding is not painful. Very first thing, actually, as we do with other treatments as well too, depending on, if your tooth has been sensitive for, some reason, your dentist, if you're coming to me as my patient, the very first thing I will make sure is that you're comfortable. If there's any sensitivity on the tooth, or I expect that there will be some sensitivity during the procedure, I am going to make sure that you get anesthetized, you get numb, so your procedure is comfortable and there's no pain and there's no discomfort involved in the process. Another question I do get asked is, can I brush and floss my teeth after dental bonding? Yes, you can brush and floss your teeth after dental bonding. In some scenarios, if you were anesthetized, in that case, your dentist will give you special recommendation for example, to wait for a certain period of time so that you're not biting on your cheek or your lips or your tongue. But otherwise, you should be able to brush and floss your teeth pretty much right after the bonding process, because it's once it's cured, it's fully set, and you're ready to go. Another question that I do get asked is, how long does dental bonding last? It's a great question. The longevity of dental bonding can vary from person to person, and also the area where the bonding has been done. So typically on average, we can see the dental bonding can last from anywhere from 5 years to 15 years. I have personally seen some of the cases of dental bonding where patients are bonding done for 17 years and some of even 20 years. So main thing for the longevity, as along with other dental procedures, is that once you have gotten the procedure done, make sure you're brushing your teeth, you're flossing, you're going for regular checkups, you're going for your regular cleaning. So maintenance is the key for the length of your dental bonding. So make sure you're maintaining well, you're keeping a good oral hygiene, you're going for your visits so you can get the maximum length of time and longevity of your dental bondings. Another question I do get asked is dental bonding covered by dental insurance? The answer is it can depend. Some insurances might cover dental bonding, some might not. Similar to cosmetic dentistry procedure, because sometimes if it's falling under cosmetic dentistry, your insurance might not cover. So the best thing would be to go to your dentist. If you're coming to our office, come to us. I will evaluate why is it needed for you, and then we can let you know whether your insurance, we are expecting your insurance to cover anything on it or not. So again, go for a consultation, let us look at it, have us confirm whether it's covered procedure or not covered procedure, so we can let you know. I hope I was able to answer some of your questions regarding dental bonding. If you have any other questions, we are here to help. Feel free to call us. Our number is 603-926-8827, or you can visit our website at www.smilesbythecnh.com. Send us an email and we will be happy to help you and get you in for a consultation and help you out with your dental bonding.